turned 89 years old in June. He was a very, very healthy man.
But on Thanksgiving weekend, Angela Yasenza's father, Pietro, started feeling feverish and achy. He tested positive for COVID-19 and died not long after.
It took us by surprise. We didn't expect this at all.
During the first wave, as the virus spread furiously in long-term care homes, deaths in the province soared, sometimes reaching more than 100 per day. Now, deaths are climbing again, with 22 reported today.
The elderly, again, are the ones who are the most vulnerable to severe, life-threatening COVID.
But Dr. Donald Vinn says so far the second wave has been less deadly than the first, in part because it hasn't hit long-term care homes as hard and because healthcare professionals know more about the virus this time.
We didn't have some of the weaknesses that we saw in our first wave. We had the personal protective equipment. We had an increase in the number of personnel. We had reorganization of our hospital and our clinical services.
Recent data from Quebec's Public Health Institute found fewer people who get sick from COVID-19 are dying from it. And some experts note the mortality rate is going down across all age groups.
And we're not sure why. Potentially because we've changed how we are managing cases. I think we've learned a lot about the disease since the spring.
Still, overall, Quebec has had more deaths than any other province, more than 6,000 since the pandemic began, compared to more than 3,000 in Ontario.
If you have the virus circulating amongst the older segments of the population, you're going to have a higher mortality rate.
Even with thousands of businesses closed and private gatherings banned in many parts of the province, Quebec is still seeing more than 1,000 cases a day.
We need to really be careful, take precautions.
For her family, it means holding a much smaller funeral for her father than she knows he would have wanted. Alison Northcott, CBC News, Montreal.